dermoepidermal junction, also known as basement membrane zone. So next is dermoepidermal junction, also known as basement membrane zone. Now it is very obvious from the name itself, this is dermoepidermal junction, that is, it is the junction in between epidermis and dermis. Okay, so let us consider that this is epidermis. And this is dermis. So what is in between? So in between is dermoepidermal junction. Let us consider this is the lowermost layer of epidermis, that is stratum basale. And in stratum basale, which keratin filaments are present? If you recall, I told you in the beginning that keratin 5 and 14 is present in stratum basale. So let us consider this is keratin 5 and keratin 14 filaments. So keratin 5 and keratin 14 filaments present in stratum basale. Okay, now this is attached to hemidesmosomes. Hemidesmosomes also have certain proteins. These proteins are plectin, integrin. Now this integrin protein have two units, alpha unit and beta unit. So alpha 6, beta 4 integrin. On the other side, BPAG1 and BPAG2. BPAG2 is also known as collagen 17. So all these four form hemidesmosome. Below this there is a layer known as lamina densa. In lamina densa you will find matrix of collagen 4 and also proteins like nidogen. Okay, now this hemidesmosome is attached to underlying lamina densa via filaments. These filaments are laminin filaments. And because these filaments are helping in anchoring these two layers, these are also known as anchoring filaments. And this layer is known as lamina lucida, also known as salt split layer. This is the weakest layer of dermoepidermal junction. So lamina lucida is known as salt split layer. Why it is known as salt split layer? The reason is that if you take 1 molar normal saline solution, that is a salt solution, and take the section of skin and keep it in this solution, you will find that the skin starts separating from its weakest point. And what is that weakest point? This lamina lucida. And because when we keep the skin in salt, it starts separating from here or splits from here, this layer is known as salt split layer. Okay, now let us consider this is dermis. So this lamina densa is attached to this underlying dermis via filaments. These are collagen 7 filaments. And this layer is known as, because it is present below lamina densa, it is known as sublamina densa, also known as lamina fibroreticularis. So these are various layers and various proteins which are present in dermoepidermal junction. If you see epidermis, the lowermost layer is stratum basale, which have keratin 5 and 14. This is attached to hemidesmosomal proteins like plectin, integrin, BPAG1, BPAG2, which is further attached to lamina lucida, which is having laminin protein, which is further attached to lamina densa, which is having collagen 4 and nidogen protein, which is attached to underlying dermis via collagen 7. Okay, so these are various proteins and the layers of dermoepidermal junction. Like you can see here, this is again the same diagrammatic representation. Here you can see keratin 5 and 14, which is present in epidermis, which is attached to plectin, integrin, BPAG1, BPAG2, which is further attached to laminin, which is also known as anchoring filament. This is known as lamina lucida, also known as salt split layer, while these four constitute to form hemidesmosome. Then this is attached to lamina densa, which is having proteins like collagen 4 and nidogen. This is again attached to underlying dermis via collagen 7. Collagen 7 are also known as anchoring fibrils. So remember, this is anchoring filament, laminin, and collagen 7 is anchoring fibrils. This is sublamina densa layer, also known as lamina fibroreticularis, which is further attached to dermis. Okay. Now this diagram is a very simplified diagrammatic representation of dermoepidermal junction. But if you want to see the real dermoepidermal junction, which is a bit complicated, it appears something like this. Okay, but still let us try to understand. Here these filaments are keratin 5 and 14 filaments. Then you will find plectin, integrin, alpha 6 beta 4, then BPAG1, BPAG2, then this laminin protein, then this collagen. Here you will find collagen 4, then collagen 7. So these are various proteins. Other than these important proteins, there are various other proteins also present. BPAG2, this BPAG2 is also known as collagen 17. Okay, so these are various proteins which are present here, and these are various layers. Okay, now tell me one thing. All these proteins are present where? They are present in dermoepidermal junction, and dermoepidermal junction is present below epidermis. So if any of these proteins become defective, it will lead to which type of disorder? Intraepidermal or subepidermal? Because these proteins are below epidermis, they are going to cause subepidermal disorders. Like if there is defect in BPAG1, BPAG2, collagen 7, it will lead to subepidermal disorders. So we are going to write down the names of such disorders. So all these are subepidermal disorders. And why they are subepidermal disorders? Because the defect are below epidermis. Like due to defect in BPAG1, patient can develop bullous pemphigoid. Due to defect in BPAG2, patient can develop bullous pemphigoid, linear IgA disease, lichen planus pemphigoidus, so due to defect in BPAG2, the disorders which arise are bullous pemphigoid, linear IgA disease, lichen planus pemphigoidus, herpes gestationalis, then collagen 7, epidermolysis bullosa dystrophicalis, epidermolysis bullosa dystrophicalis. So all these are disorders which occur due to defect in these proteins, and since these proteins are present below epidermis, all these are subepidermal disorders. Okay, so sometimes these questions are asked, like they might ask you that dystrophicalis variant of epidermolysis bullosa is due to defect in, answer is collagen 7. Similarly, they might ask you linear IgA disease, which of the following protein is involved, answer is BPAG2. But if they ask you that which protein is involved in bullous pemphigoid, BPAG1 or 2, because both are involved, so if both is not there, which one you will choose? 2, 1. So remember, BPAG 2 more than 1. So though both are involved, but if both are mentioned, then choose 2 more than 1. Okay. Now one more point to remember here is that BPAG1 in some books you will find they are written as BP230, while BPAG2 is also written as BP180. Can you tell me the reason? See, this BP stands for what? What does this BP stands for in BPAG1 and 2? So remember, this BP stands for bullous pemphigoid. Okay. So this is bullous pemphigoid antigen 1 and bullous pemphigoid antigen 2. So this bullous pemphigoid antigen 1 has a molecular weight of 230 kilodalton. So because the molecular weight is 230 kilodalton, in short sometimes it is written as BP 230. Similarly, the molecular weight for BPAG2 is 180 kilodalton. So that's why it is sometimes written as BP 180. So these are other names which you can remember.